All right. Good evening, everybody. Thank you so much for being here at the last Pre-Dental Club meeting of the year. Hopefully next year we will be seeing everybody in person instead of through a screen, but that is obviously to be determined. With that said, today's meeting is going to be focused more on the social justice, health disparity side of oral health, and just in general, kind of steering away from the individualistic perspective that we tend to take when it comes to healthcare, specifically in dentistry when it comes to the patient-provider interaction. That's very individualistic, and it's super crucial that we put emphasis on that, but it's also really important that we are putting emphasis on the community and the population-based side of oral healthcare as well, because currently in our system, there's quite an imbalance when it comes to that because we focus so much on individual patients rather than making sure that populations of people are able to access oral healthcare in the first place. So hopefully that makes sense. Quite the introduction. And so this slide says that in the US, healthcare is a privilege and not a right. So dental care is actually the #1 unmet healthcare need according to the Ohio Department of Health for children, which I don't think a lot of people recognize the dire need for oral healthcare. Specifically in the state of Ohio, we have almost 500,000 children who are uninsured for dental care. And so reasons like this are why nonprofit pediatric dental clinics like Kid Smiles have to exist in the way that our current healthcare system works, which is quite unfortunate that we have to rely on literal nonprofits to save children from, different dental diseases and developing too many cavities. It definitely, in my opinion, should not be that way considering the amount of money we funnel into our healthcare system, and we will continue to explore that topic today. And also for those of you who are unfamiliar, Kid Smiles is located on Bethel Road, and we typically during the year have a lot of service opportunities with them, or we'll at least have the executive director come in and speak to our club just about the need for Kid Smiles, how you can get involved, and what actions they're currently taking in the community. It's a really cool nonprofit that I was able to volunteer with consistently for a semester. So hopefully next year we'll be able to resume that. All right, so the social determinants of health are quite a mouthful, but this is, in my opinion, one of the most important things that I ever learned about during my undergraduate career in public health specifically. And I think it's extremely important that as future healthcare providers, we are all on the same page when it comes to the social determinants of health. And if you kind of break down that long word, you can pretty easily grasp what it means. But the definition is when certain racial and socioeconomic groups have worse oral health as a result of the social determinants of health, which are the conditions and the places where people are born, live, learn, work, and play. So to boil that down, if you look at the image on the left, you can see how these 5 circles relate to the social determinants. So the top one is your neighborhood and your built environment. So for example, how do you have access to sidewalks? Can you walk to your dental clinic? Do you have access to like a highway that can take you safely to your clinic or whatever it may be? On a broader perspective, do you have access to a bike trail that you can exercise on in order to stay healthy? Do your kids have access to a playground so that they can, stay at a healthy weight, and etc. So this stems far deeper than just with oral health. It really seeps into every facet of wellness. The next circle is health and healthcare, which is pretty obvious. Do you have access to healthcare? Because if not, that's obviously going to impact your oral health outcomes. Or do you have access to the top highest quality healthcare? In that case, you're probably going to be, pretty covered. The next one says social and community context. So the example I like to go to with this one is, let's say you're a working parent and you have a dental appointment um, at noon on a work day. Do you have someone who can cover your shift at work? Do you have someone who can watch your kid while you're at the clinic? So these are all questions that we tend to neglect when it comes to health outcomes because we're so focused on the actual biomedical model instead of looking at like the social context. So the next one, education, directly impacts your health outcomes. So the higher educated you are, the more likely you are to have received, healthcare or to have higher and better health outcomes. But of course, that's not the case for everyone. And also when it comes to speaking with patients, it's important that we remember they didn't go through 4 years of dental school. So it's important that we keep up with their health literacy level instead of assuming that they know what this terminology is that you're using. So kind of boiling it down in a way that's understandable. Because let's say you give them directions to do something and to take care of like maybe a suture. If you use language that's extremely, out of range and you're using like very medical related like words and terminology, you're probably going to lose them and therefore they're not going to follow the directions properly. So then they're going to have to come back in and get another suture or it will be infected. And so it's just important to always remember that we should be speaking to people at a level that's understandable according to their circumstances. And then finally, again, pretty straightforward, but economic stability directly impacts how like well your health is in general, not only oral health, but like the US is the only industrialized country that still has people who go bankrupt over medical bills, and oral health bills are definitely pretty high when it comes to, getting a tooth removed or wisdom teeth removed or something more complex like a root canal or something that is done by an endodontist. Um, so that's so those five central components.
Oh, there we go.
Classic. Sorry about that. I'm not even sure where I cut off, but thank you for bearing with me. Hopefully that doesn't happen again, but if it does, I'll be back. All right. Anyway, what I was saying, and wait, let me see if it's still recording.
It is, yeah.
Is it? Okay. Cool. Thank you. All right. So the US is the only industrialized nation that still has people going bankrupt over medical bills. And I think that's something that we should all keep in mind as being an issue that probably shouldn't be the case. Okay, so to speak a bit more about the social determinants of health and to kind of put it into perspective. So an example is that some groups of people cannot afford to pay out of pocket for dental care, or they don't have private or public dental insurance, or they can't get time off of work to get dental care. Communities as a whole sometimes don't have access to fluoridated water and school sealant programs, which are two major things that keep people like on a preventive measure from developing different cavities and etc. Also, communities not having access to healthy foods. So if your only options are fast food restaurants or gas station food because you don't have access to fresh produce, then that's going to directly impact the way that your teeth develop and just predispose you to developing different infections and caries much more at a higher rate than other communities who do have access. So another thing that many people don't recognize is the connection between dentistry and like food inequity. So food deserts and not having access to healthy produce. Also, public transportation to get to dental appointments. Do people have access to a car or a bus? Is the dental clinic located on a bus line? And all of these are factors that your patients will have to consider in order to get to your office. So I think it's important that we as dental professionals are aware that oral health is generated from far more than just your family history or your genetics or your DNA, because that's the way our current system works. It's super focused on your family history, which is very important, but actually 90% of our health outcomes are determined by what we just talked about, those social determinants. So I think our perceptions collectively have been kind of skewed to believe that DNA and genetics play a major role, and they do. That's not to undermine them, but we need to be placing more emphasis on these other social factors. Okay, so I wanted to just play this quick 3-minute video. Hopefully it works. Just to kind of show you a clinic that parallels Kid Smiles, and they also have some really interesting statistics that you can kind of keep an eye on while we watch. Let me know if you can't hear it. I'm hoping I fixed all of those issues.
For us to be able to provide for their
At Dientes, we treat patients ranging from 0 years old up to 100 plus. We see patients that are low income from various ethnicities. We may be the only resource to these patients, and they might not have access to care if we weren't here otherwise.
In Santa Cruz, everything's just so expensive. First things first, we have to have a roof over their heads and food on the table, and it's just hard for us to be able to provide for their dental care. But, Dientes makes that possible. For a parent, you want the best for your kids. See them smile and not knowing that, they're not gonna have issues in the future gives me a peace of mind that they're gonna be good.
When I get from my country, I come to Dientes and they made my x-ray and they said, you have 18 cavities. And I said, what does that mean, Because in my country is really poor country and you never visit the dentist like you did right here. It's really good service and the people is really friendly. I love that because and the other thing is my English is not perfect, but it's a lot of people speak Spanish and I feel comfortable like in home.
I started out as a patient probably about 5 years ago. At the time, I think I was unemployed. Struggling financially, and so someone had mentioned that they had inexpensive care here. I walked in essentially and had a great experience.
They make sure that I do everything correctly. So if I don't brush well, they tell me. And if I need to floss more, they tell me. So they help a lot with my teeth.
Grateful and privileged to be able to provide care to these patients, and it's just heartwarming when they thank you and when you can see that what we do has an impact on their overall life.
All right. Thank you for watching that with me. Hopefully everyone had a chance to kind of read those little blurbs and statistics in between each, shot. So with that said, just a few more things to keep in mind. One being that more people are unable to afford dental care than any other type of healthcare. So in terms of like optometry and like eye eye health care, even that is actually more affordable than dental care. So that's also important to keep in mind because the way our current healthcare insurance system works is that dental care and eye care are completely separate from your whole body care. So you have to purchase an additional plan in order to have dental coverage, and you have to purchase another plan, or sometimes they're combined to get an optometrist as well. So in my opinion, I think that actually makes people less likely to put emphasis on dental care since it's not included in the whole body package. So people have to go out of their way to make sure that they have dental care. And so that kind of forces people to prioritize, like the video was saying, other parts of their health and also to prioritize other parts of their life, like making sure that there's food on the table. Like obviously that's going to take precedent. And so by not having dental care included with the whole body healthcare insurance, it kind of allows people to push dental care to the fringe, like it's kind of on the outskirts of their immediate issues, which is completely understandable and is of no fault of that specific individual. It's more so a fault of the bigger picture because we currently don't have super affordable universal healthcare. And like I said earlier, in the US, healthcare is a privilege. It's not a right, a human right given to people. And so in 2015, the percent of people in the US with no dental insurance was 29% overall, and then 62% for older adults. And then the way that Medicaid kind of plays a role in all of this is, well, first of all, many low-income adults do not even have public dental insurance. Medicaid programs are not required to provide dental benefits to adult enrollees, so dental coverage ends up varying from each state. And as we speak, only 35 states do provide coverage. The other 15 provide zero coverage or only emergency coverage, which can still sometimes get messy. So unfortunately, there is no easy solution to this. And currently, we don't really have a structure that allows people to maximize their best potential oral health outcomes, unfortunately. And so conveniently, April is actually Minority Health Month. And this was an image I found from a dental care office who put together this kind of very summarized oral health disparity sheets. And so the first one, and I'll kind of just touch on each one. So 42% of African American adults and 36% of Hispanic adults have untreated dental disease. And of course, that's related to all of the factors we've talked about earlier. Most people would love to have great oral health. It's not that they don't want it, it's just that it's not in reach. It's not their priority because sometimes there are other things that are more pressing. And our current system doesn't align to help like a lot of people. And so in terms of children, untreated tooth decay in primary teeth, which are baby teeth, among children from 2 to 8 is twice as high for Hispanic and African American children. And 37% of Native American children from 1 to 5 also have untreated dental decay. So in terms of periodontal or gum disease, it's much higher in men than women and greatest among Mexican Americans and African Americans. And again, this typically doesn't have to do with the fact that certain people are predisposed to a certain disease more than others. It has nothing to do with that, but it has everything to do with the social determinants of health that we talked about earlier. So oral cancer, the 5-year survival rate is lower for oral throat cancers among Black men than whites at a rate of 36% versus 61%. And then access to insurance, African Americans comprised of about 13% of the population, but accounted for 21% of Medicaid beneficiaries in 2013. So these are all super important things to keep in mind. And again, typically not the fault of that specific individual, but rather the fault of a bunch of moving parts that aren't helping people reach their maximum potential health outcomes in general. Again, this is beyond just oral health. Thankfully, there are different organizations from both a local level and a state level, as well as the national level, such as the CDC, who are working to reduce oral health disparities. So if you're interested, you can kind of read through these things and these initiatives that they have put in place to make sure that the things we've talked about are increasingly getting better. Ideally, this could change overnight and people could wake up one day and have access to what should be a human right. But until then, we should rally behind these different organizations and look at a local level. For example, Kid Smiles, and give a kid a smile, or some, I forget the term or the day, but there are a lot of different opportunities for us to get involved here in Columbus. So it doesn't have to be international work. It can truly happen in our own backyard. So keep an eye out for things like that. And then a lot of people wouldn't be able to initially draw a link between things like racial injustice and oral health inequities, or health disparities and, you know, other racial injustices. But there are many papers that you can find that have been peer reviewed. And this is just one that I found, for example, called An Overview on Racism and Oral Health Inequities. And so this is like, these are things that are well studied. They're not just random phenomena that don't have any explanation. It's actually, that's the furthest thing from the truth. These things can be drawn to very specific things, or lack of things, lack of resources, lack of accessibility, lack of affordability. Even from a cultural perspective, if you have patients who speak another language, that can prevent them from, you know, receiving their best experience. So making sure that something as small as having your consent waiver printed in a different language could really help people. And just, again, treating individuals like they're human beings with multifaceted and complex lives, rather than just treating your patient as someone with a cavity, rather treating them as a holistic human being with many, you know, different levels and responsibilities in their community. Maybe their identity is as a parent or as a community organizer. So just making sure that we're steering away from this idea that people need to be fixed, and then we patch them up and we send them out the door and we wait until their next visit when something else goes wrong. Hopefully we're taking more preventive measures, and hopefully we're also looking at people as a full package. So with that said, that was definitely a lot to talk about. I wanted to end the year on this note because I think it's extremely important that we're thinking about these things, and that we're not only thinking about them, but actually enacting them in our daily lives. Even though we're not dentists yet, we can be working in our community, doing service, being involved in clubs, and like looking out for each other, especially as a pre-dental club. I feel like we are all on the same team, and hopefully we are all leaning towards collaboration rather than competition. So I just wanted to end the meeting on a really important topic and subject, and hopefully something that we can all take with us throughout the rest of undergrad and throughout dental school, and then eventually as dental practitioners. So with that said, thank you for being a part of the Pre-Dental Club this year. It has been such a joy. There have definitely been a lot of ups and downs, but I'm surprised I only ever had one technical issue, and it was during this meeting. So I'm glad that that wasn't too much of an issue, but I'm sure a lot of us are experiencing Zoom fatigue at the moment. So I kind of just wanted to open up this short meeting and turn it into just kind of a Q&A. If you have any questions for me or the rest of the executive board, or if you have any comments or questions about the presentation from today, feel free to stick around. But I kind of just wanted to make it short and sweet so that we can all relax before finals and maybe get a head start on studying and assignments. So I can open it up to the chat, or if anyone has any questions or comments about anything. feel free.
Lily, I just want to say you did like a great job presenting all year. It's not the easiest thing to do, but you were great. So nice job every other week doing that.
Thank you so much. That means a lot to me. I appreciate it. I really enjoyed, presenting, even though sometimes it feels like I'm speaking into the abyss, but I appreciate that a lot. Thank you. Okay, so someone asked if there is going to be a group meet or something made. Yes. So there will be a new group me made for the upcoming executive board, and then we will keep the group me that we currently have for all of the students. I think there's like 300 people in the current pre-dental club chat, but the admin will just be switched over to the new person. So I'll definitely get back to you on that one in more depth. All right. Yes, I'll answer that in more depth later. Are there any other questions? Does the e-board have anything to say? Any final remarks or final advice?
I guess just thanks for a great year. Lily, you did an amazing job with everything this whole year.
Thank you so much. All right, if not, everyone is free to go. Good luck on finals, and have a great summer too. We will reconvene in August with our new executive board, which is really exciting.